Hello, and thanks for joining today. Today we will be presenting on the effectiveness of 1-dose versus 2-dose of hepatitis A vaccinations in children. This presentation is brought to you by Misty Moody, Kimberlyn Moore, Tina Wynn, Veronica Ned, and Leslie Oates as part of Texas Women's University's Evidence-Based Practice Promotions and Quality Outcomes course.
Hi, my name is Misty, and with Healthy People 2030 reporting increased rates of hepatitis A, our group developed the following PICO question. In children under the age of 18, how does the implementation of a 2-dose vaccination program compared to a single-dose program impact immunity and incidence rates of hepatitis A?
Our objective today is to analyze whether or not a 2-dose hepatitis A vaccination program offers better long-term immunity and lower incidence of hepatitis A as it compares to just a 1-dose program. This analysis is aligned with the Healthy People 2030 goals. Hepatitis A, for background, is a highly contagious liver disease that can spread through contaminated food and water, especially affecting children whose immune systems are still developing. To address this question, we reviewed evidence from randomized controlled trials, observational studies, clinical practice guidelines, and systematic reviews. These sources helped us analyze whether a 2-dose vaccination schedule is actually more effective in reducing hepatitis A incidences as it compares to a single-dose schedule. Our study specifically explores if a 2-dose hepatitis A vaccination can lead to improved immunity and reduce incidences of hepatitis A in children and adolescents up to 18 years of age. The findings indicate that a 2-dose schedule provides longer-lasting immunity and is associated with lower hepatitis A rates. We recommend implementing vaccination policies that mandate the completion of a 2-dose series. By collaborating with public health officials and by advocating for policy change, we can significantly increase vaccination rates and decrease hepatitis A morbidity.
So my portion is the significance of the problem. And the significance of the problem is that Healthy People 2030 is saying that the Hep A cases are on the rise. So Hep A is the leading cause of viral hepatitis in the entire world. It's a highly contagious virus that can cause liver disease. And depending on the severity of the disease, it can even cause death. So there is no treatment available for Hep A, but there is vaccines that have been available since the 1900s. So our goal was to research and determine whether a single dose or a double dose would be needed to provide children with long-term immunity. And if we can determine that dosing schedule, we could potentially improve health safety as well as lowering healthcare costs.
Hello, my name is Kimberlyn Moore, and I will be doing the review of literature for this here project. Search terms included vaccinations, hepatitis A dosing schedule, immunizations, humans, children, hepatitis A, pediatric immunization schedules, booster, vaccine efficacy, pediatrics, 1-dose or 2-dose immunology, RCT, and systemic review. We also utilize inclusion criteria and exclusion criteria. Inclusion criteria included children less than 10 years of age, involving vaccination procedures, dosing schedules, 1 versus 2-dose of hepatitis A vaccine, immunological and epidemiological long-term effects, and antibodies persistent. Exclusion criteria focused on adult populations, studies comparing 2- and 3-dose vaccine efficacy, non-human studies, newspaper articles, social media content, immunizations after exposure to hepatitis A. So research found that a significant dose hepatitis A vaccination a single dose hepatitis A vaccination can offer significant initial seroprotection and immune response in children. A 2-dose schedule appears more reliable for long-term immunity. So although we found that one dose hepatitis A vaccination schedules were effective in preventing hepatitis A and providing immunity for those children, we also found that 2-dose vaccination schedules were more effective in providing long-term immunity and assisting with prevention of hepatitis A in the communities. Research consistently showed that single-dose vaccinations provided protective antibody levels, and 2-dose schedules strengthened and extended immunity, reducing the incidence of hepatitis A in children under the age of 18. The literature review also included evidence-based solutions, which states that children who miss routine hepatitis A vaccinations should vaccinate as soon as possible so that they are able to complete the 2-dose vaccination schedule. The literature also states that school and state policymakers should implement mandates to complete hepatitis A vaccination before returning to school for the new school years. In addition, educational campaigns should address vaccination misconceptions and emphasize the importance of a 2-dose vaccination regimen amongst those children.
Dissemination and evaluation. For the dissemination part, we consider it important to add the collaboration of stakeholders in order for a vaccination program to succeed. In this manner, we are providing evidence of the impact of our findings to allow stakeholders to make informed decisions about resource allocation and best practices for future projects in healthcare. For this reason, we have put emphasis informing policymakers and healthcare professionals on the effectiveness of a 2-dose hepatitis A vaccination protocol and the impact it has on long-term immunity. Similarly, create collaborations with public community centers, schools, and clinics to spread awareness through flyers, seminars, questions and answers, media about the importance of completing the full dose of hepatitis A vaccine. We also believe that this project will have a greater impact in our community if there is collaboration with local government agencies to implement vaccination pop-ups for children and adolescents who miss their routine vaccination. Evaluation. When it comes to evaluation, we have identified some important points. To establish a comprehensive evaluation for both short-term and long-term effectiveness in seroprotection and impact in hepatitis A programs. To periodically retrieve data from CDC and local healthcare agencies to assess if the current program is meeting the needs of pediatric populations. Request feedback from healthcare providers and caretakers to measure the effectiveness of educational material and recommendations. Last, to monitor hepatitis A vaccination rates in communities after the implementation of 2 doses versus 1 dose of hepatitis A vaccine program to assess for strength and weakness of implemented policies and procedures. Thank you.
After a review of the literature, our group was able to conclude that while a single-dose hepatitis A vaccine offers some protection and immunity against hepatitis A, the 2-dose schedule offers more long-term immunity. Therefore, a 2-dose vaccination schedule can reduce the incidence of hepatitis A and offer long-term immunity in children under the age of 18.
Our recommendations for interventions include policy change, as discussed, educational campaigns, and training for healthcare providers and caretakers. These strategies emphasize the importance of completing the 2-dose series as they ultimately reduce the risk of hepatitis A outbreaks in vulnerable communities.